Dr. Fehrman, give us a little bit of an idea of when a mom or a dad, anyway, parents, when should they start paying attention for their children's teeth, crooked, not crooked, and start seeing a orthodontist, probably even before the parents ever sees that there is a crookedness, because it looks to me like you as a dentist, by doing the right examination, will see something coming way before it's visible. So tell us, when should the child go to an ortho? What type of observation should a child undergo?
Well, you're right, Helmut. Typically, the dentist has been bringing it up at some of the dental exams as the child was very young. But the classic answer to that question is by age 7 is when most people recommend you see an orthodontist. But I guess what I say is, as soon as the parent has any suspicion or notices a problem, or even just if you don't notice a problem, it's fine to bring them in for a look. It's peace of mind. It takes 15, 20 minutes to have somebody take a look, and then you know what's going on. But the classic answer is age 7. That's when the lower incisors and the upper incisors, front teeth, start to come in, and that's often when you see a little bit of crookedness. So that's why age 7 is the magic number, I guess.
Mm-hmm. Is there anything a parent could do or not do with their children, maybe from very young age, or from in order to kind of help the child maybe to develop better teeth, such as no gum sucking, no thumb sucking, or I don't know, things like that. Is there anything, some habits a child or a young person should have or not have in order to perhaps come out better in the end?
Yes, there are. In fact, we know that habits can cause a huge difference in the patient's teeth and appearance of their jawbones even. So things like thumb sucking, any digit sucking, are very, very prone to cause severe bite problems. So you could do that as a parent. Pacifier that's used too long can cause the same problems. Even though they're called orthodontic pacifiers, I still have seen many severe problems when the patient uses it too long or too vigorously. Tongue thrusting is another common problem, where when a patient swallows, they will stick their tongue forward between the teeth. And we know that babies swallow that way before they get their teeth. But typically once the teeth erupt, then we switch to the adult swallow and our tongue never touches our teeth anymore. Well, people with a tongue thrust push on their front teeth every time they swallow, which is thousands of times a day, and it can really blow the teeth forward. So certainly habits, lip biting, lip sucking, all of those things play a huge role in how the front teeth fit together.
I see. So if a child does those things, it's maybe prudent for a parent to visit an orthodontist and say, look, he's doing that. Maybe you can have some suggestions on how to get rid of it. I don't know whether you do. And at the very least, you should keep, I guess, observing the child continuously of what is happening,
Yes.
Right?
Yes, I agree. That's exactly right. If you have any suspicions, bring them in. The orthodontist will talk about it. And believe it or not, patients, even very young ones, will take suggestions from the doctor a lot better than they take it from their parents. So a lot of times it becomes a real battle at home with regard to like thumb sucking or something. And I can't tell you how many times they'll come in, and in 15 minutes I've talked about it with the young child, and we've had a little heart-to-heart talk, and they accept it. They quit immediately, and it's totally different coming from me than it would be from the parent. So it's a pretty simple thing to bring someone in and talk about it.
Yeah. Well, the phenomenon of parents listening to the doctor more, or for that much to anybody more than to the parents. That phenomena, if you might have noticed, barely ever stops. Have you noticed that our wife sings all the time and we don't do it?
Right.
And then some neighbor or some consultant or some guy on the radio says something and we come home, honey, we've got to do this. And she goes, well, I've told you that for 20 years.
I told you that 10 years ago. I know, I understand, yes.
So there is that third party endorsement or authority level, which is it's a very important point you brought up, because it's just a human whatever. We act like that, we are with one particular person. I mean, and we especially know that children, I personally don't have children, but I was a child, and I know whatever Dad said, that was just because he looks at me as a little boy, and it wouldn't make a difference. But when somebody else said it, who was much less qualified maybe than my dad, it sunk in.
Right. Yes, so, it's a huge factor. Yeah.
It's a huge factor, and we got to take, knowing it, we as parents, I guess in this particular case, we got to take advantage of it. Kind of bring the person to somebody so somebody else says it. Wonderful. Okay, good. Anything else you think you need to add on there on about parents and getting their child ready for orthodontics or
I guess I would like to add that positive reinforcement works a lot better than negative reinforcement when you're trying to change a child's habits. So I tell parents to use things like star charts, or let the child work towards something that they would really like, a new doll or whatever. They'll tell you what they want, but every time they go without the habit for a night, you put a star on the chart, and they take to it very well, and they like working toward things positively rather than a negative situation. So I tell the patients, we're not trying to punish you. We're trying to help you. So you have to think of it in those terms. This is to help you, not to punish you. Right. But I got to give up that security blanket, though.
Right. And it's interesting, I can see that, you're talking to the patient, so even if that child is only 7 years old, you're looking at him as the patient, not at mom as the patient. And yes. you're talking to him/her. And I guess the kid right away gets it. Oh, I have something to say in this. This is me. This is about me.
Right. Exactly. I make sure that I would address my comments to the patient. A mom is sitting there listening, but I'm having a conversation with that patient because it's about them. So, and I want mom to hear about the positive things. So it's helpful to have the parents right there, but I'm talking directly to the patient. Yeah.
Right. Beautiful. I can see that is a very important thing, because sometimes you go somewhere for whatever it is, and be it buying shoes or whatever, and the salesperson is only talking to the parents. What do you think? Do you like them? And you're sitting there and you go, what about me?
I agree. Yes, that's the wrong way to do it, I think. So.
I love it. Thanks a lot, Dr. Fehrman.